The FDA has taken another big step in the battle against COVID-19 today as it approved booster shots for kids as young as 12. This comes as cases are spiking across the country. Wendy Gillette has more.
The FDA authorized vaccine boosters for children ages 12 to 15 years old. The agency also said everyone 12 and older eligible for the third dose of the Pfizer vaccine can get it 5 months after their second dose rather than 6 months.
We're most interested in making sure that we prevent serious outcomes such as hospitalization and deaths, which, granted, though uncommon in 12 to 15-year-olds, can occur.
The CDC still has to sign off on the booster for younger teens. The move comes as the number of new U.S. cases hit an all-time high last week, nearly 500,000 in one day. In Florida, positive COVID cases soared past 40,000 per day last week.
Particularly South Florida, we do believe it's overwhelmingly Omicron infections that are occurring, but Delta is still there.
In New York City, where new cases jumped 218% in just 2 weeks, children headed back to school.
I know her class, they had a couple kids in there that was tested positive. So we're going to see.
New Mayor Eric Adams greeted students in the Bronx and vowed not to return to virtual learning.
We're staying open.
Millions of COVID tests have been sent to schools across New York City to make sure those who are infected stay home.
We need more testing. Testing needs to increase across the country to be able to stop the spread of the virus.
New York City's school chancellor announced a new COVID command center to report pandemic-related issues, including problems with testing and lack of staff. Wendy Gillette, CBS News, New York.